Hild is executive director at Consumers Research. Wants to know what the heck is going on at Vanderbilt. What are they hiding? Putting VUMC on blast. Good morning, Will.
Good morning. Good to be with you.
Yeah, good to have you back. So, what are they doing?
Well, we don't entirely know. That's what's interesting about Vanderbilt. They are hiding everything to do with DEI and all these initiatives that they were out and proud and bragging about during the Biden administration. Now that all this stuff has been made illegal and could bring down consequences on the healthcare system, they are putting it all behind password-protected websites. Their DEI pages are gone. Their other woke initiatives are now behind password-protected. And so the question is, are they still doing it? We don't know. They haven't disavowed it. They haven't even deleted the pages. They've just put password protection in front of them. So we've sent a letter to the Department of Government Efficiency, DOGE, questioning, hey, what's going on here? Someone should look into this. Government money goes to this institution. You know, this is probably not going to come as a surprise, but hundreds of millions of dollars goes into all kinds of healthcare systems from our federal government. And, you know, according to the president's directives, they shouldn't be doing DEI anymore. So we're raising that question.
Okay, and so for people who don't know what DEI, it's where they hire people based not on their merit, but on their color or their gender or their lack of knowing what their gender is. I mean, they have to have a certain number of people who fall into those categories hired or on their staff or whatever the case may be. They have to meet a quota, basically, for people who may not be as qualified as others who could be better serving the people who come there, right?
That's exactly right. It stands for diversity, equity, inclusion, which are all nice-sounding words, except what it really stands for, as you noted, is race and sex-based discrimination or discriminating people based on their sexual preferences, right? Which is nonsense. This is against federal labor law. And frankly, if the Biden administration had been enforcing just the basics of the law, none of this would be legal. And so, thankfully, we have a return to sanity in the White House these days. So we're getting back to the idea that you should be hired based on your competency, based on your skills, not based on your sex or the color of your skin. But a lot of institutions invested heavily in this. They have huge departments. I mean, I'm talking dozens, if not hundreds of people sometimes work in the DEI departments of corporations and major healthcare groups like Vanderbilt.
To do
and
what?
These people don't want to lose their job.
But what are they doing? Are they like recruiting people? I mean, what are these giant offices of DEI people doing?
That's a great question, and to tell you the truth, it varies. In some of them, they come up with different ways to discriminate against people. We hit the Cleveland Clinic a few weeks ago. They had a patient program that was specifically just for minority patients. So they weren't just discriminating in terms of hiring and promotion. They were discriminating in terms of how they treated their patients. What? So it just depends based on, what kind of industry you're in. And a lot of this, frankly, is jobs programs. Conservatives laughed, 10 years ago when they would see these lunatics on campuses, these woke lunatics, screaming that they didn't want somebody on their campus or whatnot. We said, wait till they get in the real world. Well, the joke's on us because they did get in the real world. They all work at DEI departments. They've been pushing corporate America and these health systems in a completely woke direction. So they're going to have to be chiseled out, but you can't chisel them out if you don't know what they're doing, which is why Vanderbilt is hiding. And so we have a website, whatisvandyhiding.com, that I recommend everyone take a look at because you'll see they have been. It's not clear that they are not doing DEI anymore. They're just not bragging about it.
And they're not. They're clearly up something if they just hid everything.
Exactly.
Yeah.
And that's what we're finding is that a lot of these institutions aren't actually ceasing the illegal behavior to follow these executive orders from the president. They're simply hiding it or changing some of the nomenclature, the naming around it. But that's not good enough. When we go into the Vanderbilt health system, patients have a right to know that they are being treated by the best of the best, not people who are chosen because of their sex or their race, but people who are chosen because they're the best doctor that they could find. And that's what we're calling for. And that's why, by the way, that's why all this stuff affects consumers. We're the nation's oldest consumer protection organization. That's why we care about this, because when you focus on DEI, when you focus on discrimination in hiring and promotion, what suffers is patient care. What suffers is your ability to serve your consumers. And so that's why this is so evil and obnoxious.
I'm a white woman, so I fall into a minority, and I still don't think it's ever held me back in my life. When you're young and you're not ugly, a lot of people say, oh, you just got there because, you slept your way to the top or whatever the case would be, or they just hired you because you're pretty or blah, blah, blah. You get that a lot when you're a young female. But I can't imagine even wanting a job if I wasn't qualified to do it. You know what I mean? If somebody, let's say I'm a brain surgeon, but Ben Carson applies for the same job, and they give it to me, I would even question that facility at that point and be like, do I want to work here? I mean, I can't separate, Siamese twins. But you sit and you wonder, why would somebody even want to be chosen just because of their physical characteristic? Why?
Well, that's such a great point that you raised there, because that's, the concern that you mentioned, that when you were young and attractive, people start rumors that, you got the job because of that.
I heard it all the time.
Imagine doing that to all of society.
Yeah.
I've never thought about the skin color of a doctor. I've ever walked into the exam room and thought, oh, well, they're black or they're Hispanic. But here's the problem. When we hire not based on merit, not based on skills, not based on competency, we are going to re-inject those types of stereotypes back into people's thinking. Because if they know that a non-white doctor did not have to meet the same requirements that a white doctor did, it's not a matter of racism. It's a matter of knowing that society no longer is filtering for competence when you're dealing with certain races. And that's one of the real insidious parts of DEI. It's bad for everybody. It's bad for every single person involved, because the competent black doctor, the competent Hispanic doctor, the competent non-white doctor, they're going to suffer because they're going to now face those same questions of, are you just in here because they needed a certain number of people to pass medical school or get through a residency, or did they hire you because of your skin color, because they hit certain quotas? So the competent doctors who are non-white are going to suffer that same kind of questioning of their skills. And that's not a fault of, what will happen is they'll start accusing patients of being racist. But that's not what's happening.
Exactly.
What's happening is they are creating the stereotypes. The DEI people are creating the problem. That's why they have to be chiseled out. So it is bad for patients. It is bad for doctors. It is bad for the country for this to be going on. That's why we're raising the alarm, because it's not enough to just hide it. It needs to go away, period.
And it's supposed to. So I don't know why they're trying to hide it, because they're going to get caught if they're doing it. I've never ever based a doctor whether I thought they were good enough to care for me or not. But sometimes as a woman, I want a girl doctor. You know what I mean? Sometimes I want a girl doctor just because there's something going on where I don't think, even though he might have read the textbook and passed all the tests, I just want to talk to a girl.
I totally understand. My wife's an OBGYN, so that makes total sense to me.
Yeah, I mean, I want a girl in there. I don't want a dude in there. I mean, I've gone to a lot of men doctors in my life for various things and whatever, and I've always felt comfortable with them. But you get to a certain age and you're just like, I don't want a male doctor. And they get mad at you sometimes. And it's like, there's absolutely nothing wrong with you. You're a wonderful human, but I want to have that choice without being called a racist or a sexist or whatever. But this opens the door for malpractice insurance is high as hell. Let's just be honest. I mean, it's almost, people aren't even becoming doctors as much as they used to because of malpractice insurance. I imagine that with DEI, and not every bad thing that happens with airplanes and doctors and whatever else is DEI, so stop that. Somebody just said, well, everything that goes wrong is DEI. No, it's not. But this would draw in the whole malpractice insurance thing to a new level, wouldn't it?
100%, because you're talking again about filtering people out not for their skills or competency, but simply because they hit certain demographics. And I will do you one better. We're the number of doctors per capita in the United States has basically been unchanged for the last few decades in terms of, for every 100,000 people, how many doctors there are. But the number of medical administration staff, and that's what DEI would fall into, has skyrocketed. So when you talked about malpractice insurance, which is obviously one of the huge factors that goes into the increasing cost of medical care, but another part of it is overhead. Mm-hmm. And DEI does nothing to contribute to the outcomes. In fact, it makes them worse, but it's huge increased costs. I mean, people who walk in and use Vanderbilt Health Services are paying the salaries of these DEI departments. That has to be built into the cost of care. So when you talk about wanting to see, your doctor, and they're going out of business because the insurance, the malpractice insurance is skyrocketing. A whole other factor is this insane exponential increase in administration costs and staff. Mm-hmm. And so we need to be looking at ways to eliminate that when it doesn't. I want people to have as much access to an actual physician as possible, and DEI just gets in the way of that, increases the cost to the patient, and doesn't do anything to enhance patient care. In fact, it distracts from patient care. So I agree with you. Not everything that goes wrong is DEI, but even when DEI isn't directly involved in the sense that they found someone incompetent and put them in a position that they weren't ready for, they still increase the cost of things because it's basically a jobs program for mediocrity. People who couldn't make it doing other things end up going into these DEI departments. So that's another reason they need to be eliminated. Like I said, the more you dig into the DEI, you realize everyone's hurt by it. The only people making out like bandits are these know-nothing losers who work in the department.
That's so funny. Where do they go to learn more about this case, Will? I have 1 minute left.
Absolutely. They can visit us at whatisvandyhiding.com. That's whatisvandyhiding.com. If they want to follow our work, they can check me out on Twitter, or X, I guess it's called, at Will Hild. That's at WILLHILD.
Yeah, and you can say Twitter. Everybody knows what you mean. Doesn't matter anyway. It's going to be something else pretty soon. Please check it out, whatisvandyhiding.com, because it just doesn't make any sense that they would want to hide it, because all that did was put a bullseye on them to make everybody go, what are they hiding? I mean, it's exactly what happens. It's like when your husband shuts his, deletes all his text messages every night, or won't give you the password to his laptop or something. It's the same kind of thing. You're automatically guilty if you won't let us look.
That's exactly right. Whatisvandyhiding.com.
Let's
answer that question.
Thanks a lot, bud.
Thank you.
Bye-bye.
Care.